Michael, how do you think that a poet can transform healthcare?
Well, poetry is about how we think, how we feel. It may have ideas, but quite often poetry is more suggestive than saying, here is an idea. It asks questions. And the thing about healthcare is that obviously we love certainties, but in actual fact there are a lot of uncertainties about it. And also that when we present ourselves and we are presented with cures, remedies of one sort or another, this involves a whole psychological stuff, a whole amount of psychological stuff about how we feel about our bodies, how we feel about the change in our bodies. And it may be that we change our appearance because of the illness or because of the remedy. So there's a lot of adjustment has to go on. And the wonderful thing about poetry is it's actually very good at catching that. It's very good at taking a moment of change and asking a person to reflect on it. And then from the healthcare side as well, you know, these are incredibly stressful jobs. The people who are nurses and doctors and carers of one sort or another, people maintaining the NHS, the buildings, they're seeing life to death, you know, within one day, within an hour maybe, of seeing births and deaths and illnesses and so on. And obviously medical practitioners are very good at placing their feelings to one side, but then the work stops, you have to go home. The work stops, you go to the pub afterwards, and all those feelings that you were pushing to one side, they may well up. What did you think? How did you feel when that baby came into the world? How did you feel when you saw that person die in front of you? How did it feel when, let's say, a particular thing went wrong? Now, all those things are totally legitimate feelings, and poetry, again, is magnificent for dealing with that, because you can write poems that are questions and don't necessarily answer them. And when you've written the poem, you can look at it, and it helps you speculate, because you've taken it out of your head, put it on the page in front of you or on the screen, and then when you look at it, you can then question it and say, is that what I really felt? Or you can look at it and go, oh, that is what I felt. Now, the moment you can, in the jargon, objectify yourself and objectify your feelings, then it gives you a certain way to cope. I mean, you distance yourself, but at the same time, you're involved. It's a very complicated feeling, but these are very helpful things to go through. So poetry is great for all that.